Now I'm going on to the healthcare system in different level in Thailand. The foundation of care is the family. The foundation of care is the self-care. I believe it's like this in other countries as well. Because when someone in the house, in your family sick, the self-care will come first. And majority of care is the self-care. And from family, go to the community and the village. There will be a primary health care. At sub-district level, there were the health center. Before, it was the health center. But later, we developed health center into health promoting hospital at the sub-district level, and people are able to get access to primary care. That's why we have the nurse practitioner who can provide primary care at the health promoting hospital by law. At the secondary care at the community hospital or at the district level. At the district level, there were a community hospital. So in Thailand, there are about over 800 districts. And every district has a community hospital, has an MD, has around begin with the 30 bed capacity, and the highest level is the excellence center or tertiary care. This is secondary care, tertiary care. Tertiary care, where the excellence center usually is, there are specialists in all area in this tertiary care, like a general hospital, regional hospital, university hospital. The medical school usually is at provincial level. Not all province has the university hospital, but in the region of Thailand, the north, the south, northeast, and the central, like Bangkok, there are medical university hospital. The faculty of medicine is there, and faculty of nursing as well, and other health science faculty. So when you compare about what is the percentage of each level of care, okay, I think I do have. Self-care is around 70%. And then the tertiary care may be not more than 20%. But the cost is very high. So we should focus on the primary care, primary health care, and self-care. These are the most important. In this area, in this level, prevention and promotion is the most important one. Now, healthcare delivery system in Thailand. From Bangkok. In Bangkok, there are 19 specialized hospitals and institutions. So it's clustered a lot in Bangkok because Bangkok has more people, more population, and it's clustered there in Bangkok. 4 hospitals under Ministry of Defense, 5 medical school hospitals, 9 hospitals, and 83 community healthcare centers. This is Bangkok alone. But regional hospital At regional level, there are 38 specialized hospitals. The Department of Mental Health, and also actually it has 12 regions plus Bangkok made it 13. The provincial level, there are 77 general hospitals, 7 medical school hospitals, 52 hospitals under Ministry of Defense, and 15 municipal health centers. District level, or maybe municipal, or you can say community hospital here, 825 community hospital. Some community hospital, they develop to be a municipal health center or sub-district level. 9,791 health promoting hospital. That means each sub-district have more than 2 hospitals. They also have community primary health center, primary health care center. We have village health volunteer. This is their functioning 834,000, or maybe become nearly 1 million now. During the COVID pandemic, the health volunteer contribute lots of work to the COVID-19. For the health administration, this I just go a little bit quicker because different country, there are different administration. Provincial health administration, usually from this is the blue one is at the Ministry of Public Health. The Ministry of Public Health, they have a permanent secretary. Ministry of Interior, they have permanent secretary. The technical department, director general, and these are the blue color is at Ministry of Public Health. At the provincial level, provincial administration officers, the provincial chief officers, we have 77, include Bangkok. At the provincial level, we have the regional hospital, community hospital, district governor or the mayor, the primary care unit or Tambon health promoting hospital, district health officers. So if you look at Thailand has in some country the district, the Tambon health promoting hospital may be the health post like that. But in Thailand, we have from the province go down to the district. They have district hospital or community hospital. And then they have sub-district, which is health promoting hospital. And then at the village, they probably have a primary health care center. And these are the manpower per 1,000 population. That means one doctor taking care of around 2,000 people. The dentist, we have less, a lot less. Pharmacy, 0.2. The nurses, we have 2.4 per 1,000 population. But this may be clustered in Bangkok. The distribution may not be very good, but this is the average for the whole country. The healthcare dimension, I have mentioned that self-care is around 70 to 80%. The modern medicine is only not exceed than 20%. Alternative care or traditional medicine around 10%. This is about the healthcare dimension. The healthcare management. Ministry of Public Health oversees the national policy regarding health policy, oversees by National Health, by Ministry of Public Health. National Health and Security Office allocate funding through UC program. I talk about this after that. National Health and Security Office is the office that hold the funding of all the country. The universal health care provided through 3 programs. One is through the civil service welfare system for government officers or civil servants and their family. This is cost a lot of budget. The Social Security for private employee, which is co-payment by the employees and their employer. The employee may pay like 3% and the employer add on around 5%. The universal coverage scheme for all other Thai nations. If you are not employed, you are not a government official, and then you still get access to healthcare through this program, universal coverage scheme for all other Thai nationals. So this is something that's good for the people. When they're sick, they are able to go and to get access to healthcare. Therefore, the universal healthcare is the state welfare. Civil servant or medical benefit, this is a fringe benefit. And Social Security is a social insurance. This is the group. The UC or universal healthcare is around 74.2%. And civil servants or government officers about 6.6%. And the Social Security is around 11.5%. The benefit, outpatient, inpatient, registration with hospital benefit exemption. They have a detail about all of the benefit. People, they have to study, and now they are only using the ID, the population ID, and they will know whether they in which group of health insurance. The financing source of funding, where the universal health care came from the government budget. The civil servants or the government officers from the government budget as well. But the Social Security, they came from employee and employer. The payment methods, the UC per capita or capitation and performance related. Co-payment 30 baht per visit, equal to around $1. Aim of universal health care, they are aiming for the quality health service for all, the accessibility for everyone, the efficiency of the health service, the choice for the service, and good health for all is the last one. The principles of UC of healthcare the universal coverage. All Thai citizens receive healthcare according to the standard and the benefit package. There is a master plan and coordinating mechanism for all agency financial and institutional sustainability. This is the principle of UC. Community hospital under UC, we call contracting unit for primary care. These are the community hospital. The role is to provide medical care to the people who register to that hospitals. You can change hospital as well. When you move to work and then you can change where you work, you can do that. Before cannot, but now it's more flexible. The health expenditure per person per year for universal health care is 3,784 Thai baht per capita. Per capita, that means per person per year. It probably equal to like $120 some per person per year, which is, I think it's not expensive. But they would like to increase more. From my experience, I would like to increase the part of health promotion. But now the majority of the expenditure goes to the medical care, go to the hospital, big surgery that costs a lot. And the health promoting hospital, the care provider at Tambon and village level that have less than 10,000 population, there were about minimum of 3 personnel, but usually have more than 3. The public health officers, the nurses, the midwife, and the dental nurse. So they do the integration service, support primary health care, the basic dental care. They do home visit. They do long-term care as well. The District Committee for QOL Improvement. Sorry for the composition of the committee. The District Committee for QOL Improvement, or we call in Thai is Porchok, or at the district level. It just happened not long ago, 2018. In 2018, at the district level. And the composition of the committee chaired by the district governor or the mayor. 6 persons are representative from the government, and then 6 from the non-government representative, and 7 from the district resident representative, and chaired by the mayor or the district governor, and the district health officers being a secretary. This it's new to Thailand, but I think it's quite productive for this committee for quality of life improvement. I will discuss with you on this in more detail. The District Committee for QOL Improvement at the District Committee and Sub-District and the Village Committee. This at the Sub-District and the Village is not in the national order, or it's not in the announcement in the law. It's not a law. The sub-district committee and village is not a law. But to make it function, this just add on after they start to work. So most of the province has sub-district committee and village committee. What is the role and function according to the law of this committee? They identify the issues and develop the strategic plan to improve the quality of life of the people based on the district situation and based on the participation of the people at the community level. The implementation of the plan through integration and collaboration with other related ministry. So come together and work together, like social welfare, like Ministry of Defense, Ministry of Education, Ministry of Agriculture, come together and work together, share resource, budget, human resources, also to integrate in the work. Support and implement throughout. And also coordinate with other related network, monitor and evaluation. These are the role and function of the district quality of life improvement committee. So this in responding to Health for All by the year 2000, we did not 100% achieve that. So this is the strengthening of the administration to develop this committee before they become a committee proposed to the government. The country have done several research and action research 2-3 years ahead before we propose to the government, and then this was happened in 2 years ago. In 2007, the 30 baht scheme of healthcare policy was replaced by full public aid policy. Why it's like that? Because they changed the government. The 30 baht scheme of healthcare then became a policy again when another government changed. So in 2011, so it's back to be a 30 baht scheme again. Even though $1, it's not much, but it means something to the people. At least they can contribute something. The achievement of universal healthcare scheme. This is a quite important policy, and many other countries also saying that the Thai policy regarding universal healthcare it's a good policy. Even among Thais ourselves, we like this policy because people that they are unemployed, they are poor, they can access to healthcare. The UC has revealed that it is a good project and beneficial for people, especially for the poor. Community hospitals and health center has translated the policy into action in a concrete manner, effective, is easy, accessible, good quality. Nowadays, people that they are under social security, they said, 30 baht scheme or UC is better than us. So if you are unemployed, you are not under social security, you still can go under UC program. You can also the dental care is also can be done through the 30 baht scheme in different plan. It is necessary that the budget and human resource be adequate and suitable. Like per capita, sometimes it's not enough, like for prevention and promotion. Okay, that's about healthcare system and the healthcare policy in the country. I have talked over an hour, and if you follow me and you have any questions, you can ask and discuss, or if you do have anything to share, we can share to each other. I think we have around 45 participants from 18 countries, and if you have something very good other country can adopt, and please sharing with among our participants. Now, the critical emergency situation in healthcare, I think it's all over. The global emergency during this time is coronavirus disease or COVID-19. First reported in Wuhan, China in December 19. In Thailand, as of now, as of June 5th, today is 15, right? June 5th of June, Thailand reported 3,084 cases. After the first reported case in Thailand on January 31st, 2020. Now we have total death of 59 cases. What kind of surveillance and control measures the country has? Thailand has emergency decree, nationwide curfew. The curfew begins first from 9 p.m. to 3 a.m. and then the first stage, that's the first stage of curfew, and they change it over time. The second stage, the third stage, now it's in the fourth stage. Now we just dropped the curfew yesterday, or today, actually today, from 11 p.m. 11 o'clock. 11 p.m. Yes. 11 p.m. last night, we dropped the curfew due to we don't have new cases in the country for many days, 28 days, I think. Now we don't have nationwide curfew now, but at the beginning we have nationwide curfew, begin with 9 p.m. to 3 a.m. and then 10 p.m. to 4 a.m. So like that, but now we dropped the curfew. A temporary closure of schools. Now some schools, the elementary school and many schools still closed. The school will be reopened again in July 1st. And several businesses were closed. It just reopened a few weeks ago. Postponement of Thai traditional New Year. Usually we have a New Year in April 13 to 15 every year. Now we postpone because the pandemic of coronavirus. And also ban the alcoholic and beverage sales. They just permit about not long ago. They were the stage of, they released the curfew. The prohibit of entry of foreigners in Thailand until May 31st, 2020. This is the country control measures. But for the specific prevention and control measures of of the healthcare is that screen and surveillance. The market, the office, everywhere you go, they have to have a screening. Even the supermarket, they have an application, Thai Chana. Or if you don't get access to the application, you can sign your name, your address, your phone number, so they can follow up just in case there is a case reported. They can follow. They can call you and to come and quarantine. Quarantine for the people who came from the high-risk area, high-risk country. Quarantine can be done at the state quarantine and community quarantine, at the village quarantine. Full PPE for health personnel. The mask for all. Everywhere you go out from your house, you must wear mask. Social distancing, hand washing. This is the key, the hard, the control measure for prevention and control of coronavirus. Thailand now we have 3,100 and something, not much, about 2 or 3 new cases a day, but from abroad, not from the country. The impact of COVID-19, the positive impact, the COVID-19 in Thailand were under control at this stage. I hope it didn't come back for the second wave. Minimize the death. We only have 59 deaths. Reduce other respiratory disease like influenza or common cold in the children. There are less cases of respiratory infection. The positive impact, we can see the social support from the people in the country, provide support to each other, because during that time, as we know that the negative impact, the major impact of Thai economy, more than 10 million people were unemployed. The government also pay subsidy for 3 months. And it was burden a lot to the healthcare system. And the social impact, that is, you cannot count in terms of money. But when it is a social impact, the social support is also occur. Something good happen in the country. Like when they need to do the quarantine, the NGO, the owner of the hotel or the residential area, they allow the people to quarantine in their hotel, or people they don't have food, they have sharing pantry, the pantry of sharing to the people that they don't have the food to eat. And then the local government also, they have a pantry of sharing, หรือตู้ปันสุข in Thai. See, and this one is the governor of Leh province. In the back of the governor's house, he grows some vegetable, and then he cut it, and then he go to the market in the morning and buy food and put in the pantry of sharing. Then people, when they need something to eat, they can just get it free. Everyone, free for everyone. Some district governor, people donate food to the district, And the district governor and the officers plan and put in the pantry of sharing. People can come and get it. This is something happened in the country that we are not, there were no hunger according to sustainable development goal, that no hunger. So Thailand, there's no one hunger, because when they have nothing to eat, we look after them, see that they have something to eat. They are not hungry. They are not hunger. So these are something occur in all provinces, districts, village. This happen at the local government level. Okay, that's about all for me. I would like to welcome all questions or something that you have to share. You can share with us or share with your among the participants. Or if any question you want to ask me, we can discuss that. So thanks a lot for today. I hope you enjoy my presentation. Thank you.